Here is a detailed overview of oxacillin. #1. Generic name, drug class. Generic name, oxacillin. Drug class, penicillinase-resistant penicillin, a type of beta-lactam antibiotic. Brand names, oxacillin sodium. 2. Definition. Oxacillin is a semisynthetic penicillin antibiotic used to treat infections caused by penicillinase-producing Staphylococci. It works by inhibiting bacterial cell wall synthesis. 3. Indication. Treatment of infections caused by penicillinase-producing Staphylococci, including skin and soft tissue infections, respiratory tract infections, bone and joint infections, endocarditis, bacteremia. 4. Contraindications. Hypersensitivity to oxacillin, penicillins, or any component of the formulation. History of serious allergic reactions to beta-lactams, e.g. anaphylaxis. 5. Before taking this medicine, precautions. Inform your doctor if you have allergies to penicillins, cephalosporins, or beta-lactams, kidney disease, liver problems, a history of asthma or hay fever. Discuss if pregnant or breastfeeding. Ensure culture and susceptibility tests are conducted to confirm bacterial sensitivity. 6. How to use. Usually given by injection into a vein or muscle IM, administered by a healthcare professional. Complete the full course, even if symptoms improve early. 7. Dosing information. Adults and adolescents, IVIM, typical dose, 250 milligrams to 1 grams every 4 to 6 hours. Severe infections may require higher doses. Children, based on weight, 50 to 100 milligrams per kilograms per day, divided every 6 hours. Neonates, dosage adjusted based on age and weight. Renal or hepatic impairment, dose adjustment may be required. Miss a dose, overdose dose. Take as soon as possible. If it's close to the next dose, skip and resume regular schedule. Do not double dose. Overdose symptoms, nausea, vomiting, seizures, confusion. Seek emergency medical attention. Stop or avoid taking. If you experience signs of a serious allergic reaction, rash, itching, swelling, severe dizziness, breathing trouble, severe diarrhea, possible C. difficile infection, liver toxicity symptoms arise, jaundice, dark urine. 10. Side effects in detail. Common, nausea, vomiting, diarrhea, injection site reactions. Serious, allergic reactions, rash, anaphylaxis, hepatitis, cholestatic jaundice, Clostridium difficile associated diarrhea, neutropenia, leukopenia, seizures, especially with high doses or renal dysfunction. 11. Vital information. Effective only against penicillinase-producing gram-positive bacteria. Does not work for viral infections, e.g. flu. Can interfere with lab tests, e.g. liver function, Coombs test. Periodic monitoring of renal, hepatic, and hematologic function recommended. 12. Other drugs that will affect oxacillin. Probenecid increases serum levels by decreasing renal excretion. Methotrexate, toxicity risk may increase. Oral contraceptives, effectiveness may be reduced. Tetracyclines, chloramphenicol may antagonize oxacillin effects. Aminoglycosides, used cautiously together, may be synergistic but can be inactivated when mixed. Thank you. Have a nice day.